Sweden has been an outlier in Europe's coronavirus battle, opting for no lockdown and advising some of the lightest guidelines. But health analysts can now say they can begin to measure the true impact of these measures on a larger scale. Keenly sought details include things like the impact of social distancing, which was introduced in March and April. Well, for more, let's speak with Jan Elbert, Professor of Infectious Disease Control in Stockholm. Thank you very much for your time. Sweden's strategy has long sort of been agonised over because they were an outlier in Europe, and particularly among their neighbours as well. At what point do we start to say this strategy might have worked? Because initially it seemed like a positive one, but then quite quickly, when you looked at the deaths per capita in Sweden, they had very grim statistics.
Well, I would say that we don't know the end result yet, but what we have seen in Stockholm and in Sweden is that the high rates of new admittances to ICU and also the number of deaths have come down, so that now we see 1 or 2 deaths a day, and very few persons admitted to ICU. Whether this is a sort of a situation that will change again, so that we will see increases like we heard from other countries, we don't know. But we are much better off now than we were in April, when things were very much strained for the healthcare.
And the government have ordered an inquiry to look at their handling of COVID-19 in the country as well. One thing that was much speculated over is if Sweden was going for this approach that we were calling herd immunity. Does that look like the case? And with more information about COVID-19, is herd immunity actually ever even possible to attain?
I would say that it's possible to attain, but whether Sweden is somewhere near there, or for that matter, the UK, is still a big unknown, because there's so many unknown factors about how many actually develop antibodies and other types of immune responses after going through the disease, and how many will be required to have had the disease in order to see herd immunity. And we know that we've had more cases in Sweden than, for instance, in Norway and Denmark and Finland, our neighboring countries, many more. But whether that means that we are on our way to herd immunity is a big unknown.
Because also we don't know how and when people can be reinfected with COVID-19 as well. Thank you very much, Jan Elbert, Professor of Infectious Disease Control in Stockholm.